What's up, guys? This is Dr. Chris. I'm here to talk to you about shoulder pain, more specifically shoulder impingement. So this is something that we see all the time in our office. It's fairly common, like shoulder pain in general is one of the more common complaints people are going to walk in with, but impingement just happens to be, I think Google really gets this into people's head that that's what they have. So I find that shoulder impingement is something that our patients don't really understand, but it's something that is easily teachable or explained and that they can kind of understand it. So two types of impingement that we're going to really look at, and I mean there's lots of different subtypes and all that, but that's really not important for this. So we have what's called subacromial impingement or bursal-sided impingement. That's the more common, that's the things that we're mostly going to see in the office. And we have what's called internal impingement or articular-sided impingement. So that's more, we see that a lot with overhead athletes. I'd say swimmers and throwers, especially baseball pitchers, are really going to see that. That's going to involve more of the biceps tendon, the labrum, the things like in the joint, okay? So totally different prognosis, all that's different when it comes to that. So the focus today is subacromial. So this awesome drawing, I must brag a little bit. So I drew this in one take. I'm not an artist too, so be easy on me here. Okay, so shoulder. So we have shoulder blade or scapula. We have humerus or arm bone. The head of the humerus comes into the shoulder blade, and that's what forms your shoulder joint, your glenohumeral joint, okay? So we like to use the analogy of a golf ball on the tee, okay? So the golf ball being the head of the humerus, the tee being the joint itself. And then up here you have the collarbone and your acromion and your AC joint. So your subacromial space is this, where I highlighted in orange. So there's not a lot of room there, maybe around 2 to 17 millimeters, depending on the position of the arm. And you also have your supraspinatus and other tissues kind of running through the top that comes through. So if we start to impinge, basically what this looks like is as somebody lifts their arm up, they have to shrug to get their arm overhead, and they're going to usually get a pinching or pain maybe on the side or right in the front or right on top, okay? So you also might see what's called the painful arc, where the initial lifting of the arm is maybe not so painful, but like here all the way up to here, it's a little bit pinchy, a little pain. But then when you get over top, you're like, okay, well, it feels a little better. So that's what we call a painful arc, and it's just changing of the space in the subacromial area, okay? So what are things that are going to contribute to this? Well, the obvious, the most common thing is some type of rotator cuff pathology. So this could be just more of the irritation, like a tendonitis, bursitis type of thing, or strain, or more involved things like a partial or full thickness rotator cuff tear, okay? So the rotator cuff's job, as you lift your arm up, it pulls on both sides to keep the golf ball on the tee, okay? So if we have socket, shoulder, that rotator cuff, it helps rotate and stabilize it and keep it centered here. So when it's weak or doesn't work well or it's torn or whatever, then as we start to lift our arm, we might start to ride up and pinch, okay? So that space that we don't have a lot of to begin with all of a sudden becomes less, okay? So, and by the way, I mean, you can have full thickness, partial thickness cuff tears, but no pain. These things just kind of happen over time and then maybe start to become a problem later on. Bone spurs, so that's the more, that makes sense to people, you know. Well, if I have a huge honking bone spur sticking out of my collarbone into that space, well, that's going to cause problems. We can also have spurring or other bony type problems on the head of the humerus itself. This is also a problem in the hip and what we call femoral acetabular impingement, okay? So bone spurs could be something you can just be born with. You're unlucky in your acromion, you just have more of a hook there, okay? There's different categories for all this. Or over time, we have poor usage of our arm. Our mechanics aren't very good. The strength isn't good. And then the bone just starts to build up in different areas. Not my quote, but a common quote. It's a wonderful thing in a poorly functioning system, but it can start to cause problems. So, you know, I can't tell you if you have a bone spur if you walk in here. I can maybe estimate, but we only know that through imaging, okay? And they're not all surgically fixed or needed to be fixed. Same with the rotator cuff stuff. So we always got to really assess the whole picture. That's a topic for a different day. Overuse, so this is common too. So it's the, you know, I'm not very active, but it's spring and I want to go get a bunch of yard work and cleaning around the house all on a Saturday. So you go from 0 to 100, start using all these structures, your mechanics are bad, and then it starts to lead to this cascade of pinching and inflammation and so on and so forth. So the focus, so when we're going to look at this in the office, so if I'm going to give my best effort to help somebody, the first thing I'm going to go after is scapular strength and stability. Really, most people just have no idea how to engage the muscles of the shoulder blade, specifically like your lower trap and your serratus anterior. Those are so important to helping the shoulder blade stay locked on your rib cage, but it's anchoring down so it allows the arm to have a good platform to move off of. So we spend a lot of time teaching how to use these muscles with just open chain. So I'm going to lift my arm up into the cabinet, or closed chain. I'm doing push-ups, bench press, things like that. So rotator cuff stability and strength. Now, this is also important. I find that the posterior cuff, specifically your infraspinatus, teres minor, these muscles are just inherently weak on a lot of people. I think some of it has to do with our positioning most of the day now, where we don't really use them. And then a lot of people don't do their cuff exercises correctly. That's a different topic too. So we work on baseline strength. So I'm doing the standard stuff that most people have done, you know, just external rotation, internal rotation, things like that. But then we have to bring it all together and teach more of the mechanics of how to use the arm. And this goes for all the other rehab. Just regular corrective exercise alone isn't always going to get you a good result. So first, feel how to engage the cuff, feel how to engage the scapula, then put it all together with real life motions. Glass out of the cabinet, opening the door, picking up your kid, learning how to create a very optimal system there. So this is a crash course on shoulder impingement, subacromial focus. So in summary, it could be some rotator cuff pathology, some problem there. We could have bone spurring. I didn't put here, I could say / arthritic problems, same thing. And then the things we can control, overuse, poor mechanics. So we're spending a lot of time on that. So don't forget the scapula, don't forget the rotator cuff, and please just stop giving people just baseline exercises and then leaving it at that. You're only going to get them so far. So you got to put it all together. So if you're wanting to know any exercises for this stuff, you check my channel out, just go under shoulder blade, scapula. There's all sorts of things that I've found have helped over the years. Some work for some people, some don't, and we just have to find the right strategy for the individual in front of us.